Hello again, thanks for joining us. My name is Ernest. To the details now. The National Health Insurance Authority says it is taking steps to settle all outstanding claims owed service providers. The assurances follow claims by the minority in Parliament that the National Health Insurance Service providers may withdraw their services due to non-payment of levies by the Finance Ministry collected since July 2021. Already, the NHIS is grappling with the challenge of fraudulent claims, which is said to be affecting the cost of operation. However, addressing the press on measures being taken to improve healthcare delivery, the Chief Executive of the National Health Insurance, Dr. Lydia Jan-Selby, says the scheme is sustainable and that steps will be taken to consolidate the gains. There's more in the following report.
The National Health Insurance Scheme is a social intervention program introduced by government to provide financial access to quality healthcare for residents in Ghana. The NHIS is largely funded by the NHL levy, SNIT contributions and returns on National Health Insurance Fund investments, as well as premium paid by the informal sector. Government allocation also complements the funding of the scheme. However, in recent times, there are reports that the scheme has challenges paying service providers. Reacting to the claims, management says steps are being taken to pay all outstanding claims, as they explain a formula is usually considered in applying charges and disbursing funds to service providers. Dr. Lydia Jan-Selby is Chief Executive of the National Health Insurance Authority.
We made some payment recently of 100 million or so. Our bill is around 90 to 95 million cedis a month. And the arrangement is that when providers see a patient, when they are ready, they bring us the bills. But once we receive, we are supposed to pay within 90 days of receiving the bill. At the moment, that target is a little bit of a challenge, but a certain percentage is paid within that time. So as you can imagine, when people say we owe 50 million, we owe 100 million or whatever, we never finish paying. Today, some hospitals will bring a bill, so the claims will go up. We will pay some. Some more hospitals will bring bills. It's never ending. It's a moving target.
Describing the scheme as one of the best in the world, Dr. Selby noted that a number of reforms are being rolled out to check fraudulent claims and to consolidate the gains made by the health insurance scheme.
We are sustainable. This scheme, I don't care what anybody says, is one of the best designed schemes, health insurance schemes in the world. However, as typically faces Ghana, we set up a good plan and then we don't follow our own plan. And I think we have some implementation. We put a few people in prison, which is the figures. The one I was personally involved in stemmed from 2009, and in those days it was 500,000 cedis. The person was jailed, I think, in about 2016 for 10 years. I think his assets are being sold or auctioned or whatever to give us back the money. 500,000 now is not worth what it was in those days, but we put in measures that has reduced this. And one of them is this mobile renewal. You know, when you go to the hospital now, the facility, they have a special short code, not the star 929, for which they must authenticate every visit. And we give you a code that you put on the claims if the person is a genuine member of the NHIS. At the same time, a message is sent to the member, and it gives you the name of the hospital or clinic that is going to make or claim for money in your name. And because of that,